Oh, good morning, and I...
Tēnā koe, Mr Speaker.
Oh, tēnā koe, and I call the Honourable Annie King.
Can I begin by saying to Dr Paul Hutchison that it is 5 years that this government has been in place, and if it was so easy to resolve, why was it not resolved in the first year of a national government? And maybe it was because the whole issue actually was before the courts and could not be resolved in that time frame. He also said that the sector would be relieved. Well, I have to say that is not the feedback that is coming from the sector. The sector are bemused, they feel misled, and they are shocked. But they ought not to be, because if they go back and they read what Mr Ryle has been saying over a number of years, they would know the bottom line for him has always been cost and not care. It has always been cost and not care. Now, of course, there must be restriction on cost in the health sector. It has always been the case. But he has consistently made it clear that he doesn't agree with adult disabled children being cared for by their family. And so if you go back to statements that he made back in September 2012, he was part of the scaremongering that it was going to cost $400 million. And that really brought out some of those that have to care for families. And I draw to your attention Mr Cliff Robinson, a parent from Thames, who is caring for 2 adult disabled children. And he said, this is just scaremongering on the minister's part. It also, to even think about means testing people who are disabled just horrifies me. And I think what it has really shown is the lack of understanding about what is involved in caring for disabled children. Members opposite can laugh about it, but have they actually met constituents? And I would have thought Dr Hutchison would. I will never forget a woman coming into my office carrying her adult child. Her adult child was now 22 years of age and had left the education system and had no longer had support. And this woman, who was a highly qualified woman, had given up her job to care for her highly disabled child. And it was a huge impost on this family. You know, it's not that long ago that places like Kimberley flourished in New Zealand, where we took our disabled family members and we put them into institutions and we closed the door and we said it is the state's total responsibility to look after their family members. But over time, we became more informed and we became more compassionate about what could be done with a disabled person. They weren't non-people, they were people, people with feelings and people with needs. And so over time, and rightly so, we shifted much of the care of our disabled people into the community. And many families have picked up that role. They have given up jobs, they have given up income, and they have looked after their family members. So Paul Hutchison, when he says the Labor Party did absolutely nothing about it, is being disingenuous, because as he will know, one, it was before the court, and secondly, if he just read the legislation his own minister has put in, I suggest he reads News Section 70D. It says the Crown and any DHB are and have always been authorised to adopt or to have family care policy and to change, cancel or replace such a policy. Now, Mr Speaker, my real concern about this bill is, here we are at 10 o'clock in the morning. Last night, the regulatory impact statement on this bill was not available, as they were not available either for the housing bills. We're told to go and look them up on the internet, and I'm sure Maurice Williamson will understand this. We're told to go to www #this, #that, look it up, find the regulatory impact statement, run it off, read it. Not there, had not been put up. So the regulatory impact statement on this bill was first provided this morning to this House, and we are now required to make decisions on this bill under urgency and pass every stage of it. I have to say to those listening, this is a dreadful process. And the fair-minded people of the National Party know this is a shonky process to put any bill through that affects so many important families looking after disabled family members. Why is it being put through with such haste? It does not come into effect until October 2013. Can they count how many months away that is? Could it not have gone to a select committee for a while? I mean, I was even interested in the consultation group they set up to look at what changes they would make, the task force. Well, I noticed the task force didn't have a person with disability on it. I don't suppose that they're capable of being on a task force in the minds of this government. So there has been insufficient time, a lack of consultation, and we asked back last year, as I know other parties in this House have done, for a cross-party approach to get an agreement between parties on this very, very complex issue. Dr. Hutchison, Tony Ryle said how complex it is. So just to throw out there, oh, Labor did nothing about it, is to disregard how complex it is. But we offered a cross-party consultation on this, and were we consulted? We get a bill today and we get some information on it half an hour ago. That is called consultation and cross-party support in this House. It is just not good enough. And I want you to have a look at those members there. I can't see any of them with the regulatory impact statement. What they will have is their research party notes all saying the same thing. Go and have a look at the regulatory impact statement. I have never seen anything like a regulatory impact statement like this. Have a look at it. This is the regulatory impact statement, Mr. Speaker. Have a look at where you're meant to be finding out what's going on in this bill. This is what it looks like. It is full of blanks that we're not allowed to know much about what this bill does. They have cut out nearly all the information that would be meaningful. I particularly like page 27. Let me show you page 27. This is page 27 of the regulatory impact statement, and what does it say, Mr. Speaker? It says blank, blankety blank, 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 blankety blank, 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 blank. That is the regulatory impact statement on this really important bill. Hang your heads in shame, National Party. That is what we're supposed to make decisions on in this Parliament. When I did find some words that I could read in the regulatory impact statement, they put up a number of options from the Ministry of Health, and one of them was that we actually should pay around $16 an hour. That's what it says in the regulatory impact statement, the little bit that is written. They said it ought to be the minimum wage plus other payments that would bring it up to around $16 an hour. What does this bill do? What does the minister do? He says the minimum that can be paid is $13 an hour. And so $13.75, oh how generous, $13.75. So they are to be paid less than other caregivers in our community. I have to say, Mr. Speaker, this is not a breakthrough. This is all about trying to restrict what they will pay to people. They will restrict who it goes to and who will be paid. And I believe that they have done very little in terms of trying to get a cross-party agreement, an agreement with the very people who are affected and who look after their family members day after day. I acknowledge that it is complex, but why would we not in this Parliament at least allow the public to have a say? But I know why they don't want the public to have a say, because the public are more in tune and more empathetic to those who care for disabled adult children than the government is. And they don't want that exposed at a select committee. And I've been on those select committees where the National Party members have them and say, thank you very much for that wonderful submission. We really appreciate receiving that wonderful submission. You've spent so much time writing for us. And then vote against every recommendation the public make. So they know there would be people coming in and saying, hang on a minute, this is not what we thought you were going to do. This hasn't been worked through with us, and they don't want that to be exposed to the public of New Zealand. This is insufficient time. We ought to, this whole Parliament ought to say to the Minister, take it back give us time to work across the parties on it, bring in a bill, put it to a select committee, and you could still have it passed by the 13th of October 2013. That is what ought to happen, and that will be our very strong argument today. It is not good enough. It is disgraceful to bring in a bill and to hand us this sort of rubbish to say this is what the bill is about, Mr. Speaker.
I call the honourable member